The shocking truth about cholesterol that could save your life. Have you ever wondered if everything you know about cholesterol is completely wrong? What if I told you that lowering cholesterol can be more dangerous than keeping it high? What would happen if you found out that doctors around the world are making a serious mistake when treating your cholesterol? Many of the health problems we face today could be avoided with simple but little discussed habits. When we talk about health, it's easy to fall into the temptation of looking for quick fixes, like taking medication without understanding its implications. Cholesterol plays a vital role in our body that few know about or openly discuss. It is essential for the production of hormones, protection of the nervous system, and even the basis for our vitamin D. And yes, it can become a problem when there is an imbalance, but it is not simply lowering it that will solve everything. Let's explore how many beliefs passed down from generation to generation may be holding us back from a healthier life. Have you ever wondered why cholesterol exists in the first place? There's a reason why our body produces this all-important substance. Let's get started. The forbidden secret that the pharmaceutical industry doesn't want you to know about cholesterol. Cholesterol was not made to be artificially lowered, and this is a scientific fact that few dispute. When we understand the real function of cholesterol in the human body, we realize that it is essential, not a villain. The Cochrane Collaboration Group, which has belonged to the World Health Organization since 211,000, has come to surprising conclusions. This group, considered one of the most serious in scientific analysis, determined that the relationship between high cholesterol and heart disease is not as direct as previously thought. You've probably heard that you should keep your cholesterol low at all costs, but there's another side to this story. Statins, cholesterol-lowering drugs, not only lower cholesterol levels, but interfere with a vital metabolic cascade. This cascade, known as the mevalonate pathway, is responsible for the production of several essential substances, in addition to cholesterol. When you take a cholesterol-lowering drug, it also reduces the production of coenzyme Q10, which is vital for cellular energy. You also decrease the production of vitamin K2, essential for bone and cardiovascular health. The truth that many doctors ignore is that your body produces cholesterol for a reason that is fundamental to your survival. Squalene, another affected compound, is crucial for skin health and the immune system. All steroidal hormones, such as testosterone and estrogen, rely on cholesterol to be produced properly. The myelin sheath, which protects your nerves, is mostly made up of cholesterol and healthy fats. Bile, essential for the digestion of fats, is also produced from cholesterol. Published studies show that stopping statin use can, surprisingly, decrease mortality in certain groups. Ask yourself, why would the Creator put cholesterol in virtually every cell in your body if it was really that dangerous? The answer can completely change your perspective on health and medications you may be taking unnecessarily. Would you continue with a treatment if you knew it might be harming your long-term health? This is the question that few have the courage to ask, but which can save lives when answered honestly. The 7 surprising functions of cholesterol that your doctor never mentioned. 1. Hormone production. Cholesterol is the raw material for all of your body's steroidal hormones. Without adequate cholesterol levels, your production of testosterone, estrogen, and cortisol is severely compromised. This means that libido problems, infertility, and even depression can be related to insufficient cholesterol levels. Did you know that without enough cholesterol, a woman can have irregular menstrual cycles, or even stop menstruating? 2. Brain health. Your brain contains approximately 25% of all cholesterol in the body. This cholesterol is essential for communication between neurons and for the formation of new memories. Studies show that people with very low cholesterol have a higher risk of developing cognitive problems and even dementia. Cholesterol is so crucial to your brain that nature has developed a blood-brain barrier to protect it. When your body doesn't have enough cholesterol, your ability to learn and remember can be significantly reduced. 3. Vitamin D. Without cholesterol, your body can't produce vitamin D when your skin is exposed to the sun. Vitamin D is essential for more than 200 functions in the body, including immunity and bone health. People with very low cholesterol often have a vitamin D deficiency, even with adequate sun exposure. This deficiency is linked to an increased risk of cancer, autoimmune diseases, and seasonal depression. 4. Digestion. Cholesterol is critical for the production of bile, which helps digest fats and absorb nutrients. Without enough bile, you can't absorb fat-soluble vitamins like A, D, E, and K. These vitamins are essential for vision, immunity, blood clotting, and protection against free radical damage. Malabsorption of these vitamins can lead to night vision problems, susceptibility to infections, and osteoporosis. 5. Cellular integrity. Cholesterol maintains the structural integrity of all cell membranes in your body. It regulates the fluidity of membranes and allows for the proper transport of nutrients into and out of cells. Without enough cholesterol, your cells become vulnerable to damage and don't function properly. This can lead to a variety of health problems, from skin diseases to internal organ impairment. 6. Cardiovascular protection. Surprisingly, cholesterol can protect your heart in certain circumstances. In older adults over the age of 65, higher cholesterol levels are associated with greater longevity. This completely contradicts what most doctors believe and prescribe for their elderly patients. Your body uses cholesterol to repair damage to arterial walls, as a natural bandage for inflammation. 7. Immune response. Cholesterol is necessary for the proper functioning of your immune system. Low cholesterol levels are associated with increased susceptibility to infections, especially in children and the elderly. During an infection, your body naturally increases the production of cholesterol as a defense mechanism. Have you ever wondered why many people with serious infectious diseases have temporarily elevated cholesterol? What would you choose? A drug that artificially lowers your cholesterol, or understanding what's really causing the increase? Health alert. Why lowering your cholesterol could be slowly killing you. When you take cholesterol-lowering medications, you're interfering with a complex system that has evolved over millions of years. Statins block an enzyme called HMG, CoA reductase, which is essential for many biological processes in addition to cholesterol. This blockage affects the production of coenzyme Q10, which is vital for heart function and cellular energy. Coenzyme Q10 deficiency can cause severe fatigue, muscle weakness, and even heart failure. Many patients who take statins develop debilitating muscle pain, called myopathies, due to this effect. Some doctors have had to abandon their careers due to rhabdomyolysis, severe muscle destruction caused by statins. The side effects can be so severe that they completely compromise the quality of life of many people. The decision to lower cholesterol artificially could open the door to dozens of other more serious health problems. Did you know that statins increase the risk of developing type 2 diabetes by up to 50%? They are also associated with an increased risk of cataracts, kidney problems, and liver dysfunction. There are documented cases of people who have developed memory loss and dementia-like symptoms when taking statins. These symptoms often disappear when medications are stopped, but few make the connection. If you experience muscle pain, unusual fatigue, or memory problems while taking statins, don't ignore these signs. Your body is trying to communicate that something is wrong with the treatment that it should be helping, not harming. There are natural alternatives to maintaining cardiovascular health that don't involve artificially lowering cholesterol. Natural anti-inflammatories like curcumin have 10 times more effect than statins and cost 10 times less. Why kill a mosquito with a rifle when there is a safer and more effective way to solve the problem? What if the solution to your high cholesterol was to treat the underlying cause, such as hypothyroidism, instead of the symptom? Which do you prefer? A remedy that masks a symptom, or discovering and treating the true cause of your problem? Alarming symptoms that reveal that your cholesterol is dangerously low. When your cholesterol is too low, below 140 milligrams per deciliter, you may experience severe symptoms. Cognitive disorders, including memory loss and difficulty concentrating, are common with very low cholesterol. There are reports of university professors who have had to stop teaching due to memory compromised by statins. Generalized muscle weakness and diffuse muscle pain are another warning sign that many doctors don't recognize. Many patients complain of aches and pains all over their bodies after starting cholesterol medications, but are ignored by their doctors. Your ability to produce hormones is severely compromised when your cholesterol is too low. This can result in extreme fatigue, depression, anxiety, and loss of libido that affects relationships and quality of life. A weakened immune system makes you more susceptible to infections when you have insufficient cholesterol. In children, low cholesterol is associated with a higher risk of serious infections and even mortality in extreme cases. Skin problems such as extreme dryness, wounds that take time to heal, and premature aging can occur. Your skin needs cholesterol to maintain its natural protective barrier against pathogens and environmental pollutants. Studies show that people with very low cholesterol have a significantly higher risk of developing certain cancers. Cholesterol has anti-cancer functions that have only recently begun to be recognized by modern science. If you experience any of these symptoms, especially after starting cholesterol-lowering medications, seek help. An integrative or functional doctor can help you find a healthy balance without compromising vital body functions. Have you ever heard of these side effects when your doctor prescribed statins or other similar medications? Why isn't this crucial information shared with patients before starting potentially dangerous treatments? The Golden Triangle. How vitamin D, hormones, and cholesterol determine your longevity. There is a deep relationship between cholesterol, vitamin D, and their hormones that few health professionals fully understand. Cholesterol is the precursor to vitamin D, which is actually a hormone produced when your skin is exposed to the sun. Without enough cholesterol, you can't produce vitamin D properly, no matter how much time you spend in the sun. Vitamin D, in turn, influences the production of other hormones, including those that regulate your mood and metabolism. This golden triangle of cholesterol, vitamin D, and hormones forms the basis of your health and determines your longevity. When you balance this golden triangle, you create a biochemical foundation for a long and healthy life. Optimal vitamin D levels are associated with a reduced risk of virtually all modern chronic diseases. From cancer to autoimmune diseases, from depression to osteoporosis, vitamin D plays a crucial protective role. And it all starts with adequate levels of cholesterol, the raw material your body needs to start the process. All steroidal hormones, including testosterone, estrogen, progesterone, and cortisol, are derivatives of cholesterol. These hormones regulate virtually every function in your body, from your metabolism to your stress response. When you artificially lower your cholesterol, you potentially compromise your entire hormonal system. This can lead to a cascading drop in health that many doctors fail to diagnose correctly. Have you ever noticed how so many people suffer from fatigue, low libido, and mood problems with no apparent cause? How many of them are taking cholesterol-lowering medications and have never made the connection to their symptoms? What would happen if, instead of adding more drugs to treat these symptoms, we treated the root cause? This holistic approach could transform the health of millions of people who suffer needlessly. The hidden connection: hypothyroidism and high cholesterol. What no one told you. The main cause of high cholesterol that almost no doctor properly investigates is hypothyroidism. When your thyroid doesn't work properly, your metabolism slows down and your cholesterol naturally rises. This increase is not a problem to be treated, but a defense mechanism that your body activates for an important reason. The increased cholesterol helps fight the mucin that is formed as a result of slow metabolism in hypothyroidism. It is medical nonsense to treat the high cholesterol of a patient with hypothyroidism without treating the underlying cause. When you properly treat hypothyroidism, cholesterol typically returns to normal levels without additional medication. But how many doctors actually investigate thyroid function before prescribing statins to their patients? Most simply watch for high cholesterol and immediately prescribe medication to lower it. This practice completely ignores the wisdom of the body and interferes with a natural mechanism of adaptation and protection. Cholesterol, in this case, is just a biomarker indicating that something is metabolically wrong, not the cause of the problem. Treating only the number, ignoring what it is signaling, is like turning off the fire alarm instead of putting out the fire. Would you trust a firefighter who, upon arriving at your burning home, simply turned off the alarm and walked away? Why then do we trust doctors who do essentially the same thing with our bodies? Conventional medicine often treats symptoms rather than fundamental causes, and cholesterol is a perfect example of this. Before accepting a cholesterol-lowering medication, insist on a complete thyroid exam, including TSH, T3, and T4. Many patients find that by properly treating thyroid problems, their cholesterol levels naturally normalize. This not only prevents the potentially serious side effects of statins, but also improves your overall health and energy. Which approach makes more sense? Treating just one number, or figuring out and correcting what's causing the imbalance in the first place? Revealed. Why seniors with high cholesterol live longer. Studies prove it. One of the best kept secrets in medicine is that in people over the age of 65, high cholesterol is associated with longevity. There are several published scientific studies, not just one or two, showing that older adults with higher cholesterol live longer. This fact directly contradicts standard medical recommendations that prescribe statins to virtually all older adults. The evidence is particularly strong for older women, who appear to benefit even more from higher cholesterol levels. Have you ever wondered why so many centenarians have naturally high cholesterol without cardiovascular problems? The correlation between high cholesterol and longevity in the elderly is one of the most ignored scientific facts in modern medicine. Cholesterol performs critical protective functions that become even more important as we age. It helps maintain brain integrity, immune function, and hormone production at a time when these systems are naturally declining. Some researchers believe that cholesterol works as a natural antioxidant, protecting against the damage of aging. Others suggest that it helps offset the natural decrease in other protective mechanisms that occurs with age. Dr. Uffe Ravnskov, a respected researcher, has compiled substantial evidence showing that older adults with lower cholesterol die earlier. Despite this, standard medical practice continues to aggressively treat high cholesterol even in very elderly patients. This discrepancy between scientific evidence and clinical practice should make you question what is really motivating these recommendations. Are commercial interests trumping the well-being of patients when it comes to cholesterol medications? If you are over 65, especially if you are a woman, critically and carefully question the need for statins. What would your doctor say if you showed him scientific studies indicating that higher cholesterol can help you live longer? Would you be willing to question the medical consensus if it meant potentially adding healthy years to your life? The ancestral technique to consume eggs and boost your health in 7 minutes. The egg is one of nature's most nutritious and complete foods, a true supersource of essential nutrients. Contrary to popular belief, eggs do not increase the risk of heart disease and are safe for regular consumption. Dr. Leah Ribeiro challenges anyone to show a valid scientific study proving that boiled eggs are bad for health. The crucial question is not the egg itself, but how you prepare it and the quality of the egg you consume. Eggs fried in vegetable oils like canola can be harmful, but this is due to the oil, not the egg. The ancestral technique of cooking eggs for exactly 7 minutes preserves their nutrients while eliminating the risk of contamination. Bring water to a boil and only then add the eggs, letting them cook for 7 timed minutes. This time is enough to eliminate possible bacteria such as salmonella, but it does not denature the valuable proteins and amino acids. Consuming 2 to 6 hard-boiled eggs a day can be perfectly healthy for most people. Eggs are high in choline, which is essential for brain health and often deficient in the modern diet. They contain lutein and zeaxanthin, carotenoids that protect eye health and prevent macular degeneration. Egg proteins have the most complete amino acid profile found in nature, ideal for muscle maintenance. Eggs provide B vitamins, especially B12, crucial for neurological health and blood cell formation. There is no need to limit the consumption of egg yolks, which contain most nutrients, including omega-3 fatty acids. Have you ever noticed how traditional cultures that consume a lot of eggs often have low rates of heart disease? This pattern suggests that our modern fear of eggs and cholesterol is unfounded and possibly unhealthy. A study with boiled eggs showed improvement in lipid profiles, not worsening, completely contrary to what many doctors still believe. The next time someone tells you to avoid eggs or separate yolks, ask what scientific studies are basing that advice on. The deciding factor: how the origin of your food determines your future. The quality of the food you consume is just as important as the type of food itself, especially when it comes to eggs. An egg produced by a hen raised in healthy, natural conditions is completely different from an industrial egg. Hens that have access to pasture, sunlight, and a varied diet produce nutritionally superior eggs. The egg is essentially an excretion of the chicken, similar to breast milk, which directly reflects the health of the animal. The health status of the animal that produced its food directly determines the impact of that food on its health. Eggs from hens raised in unhealthy environments, fed with industrial feed, contain lower nutrient profiles. They may also contain antibiotic residues, hormones, and toxins that the chicken has been exposed to during its lifetime. Studies show that eggs from pasture-raised hens contain up to twice as much omega-3 and vitamin E. They also have significantly higher levels of vitamins A and D compared to conventional eggs. This nutritional superiority translates directly into benefits for your health when you consume these eggs regularly. The same principle applies to all foods of animal origin. The health of the animal determines the quality of the food. Grass-fed meat, milk from grass-fed cows, and wild fish are always superior. Have you ever considered that the increase in chronic diseases coincides with the industrialization of our food chain? This connection is no coincidence, but a direct reflection of how far we have moved away from natural and healthy foods. By choosing high-quality food, you are not only improving your health, but also supporting sustainable practices. Are you willing to invest a little more in quality food now to save on medical bills in the future? What health legacy do you want to create for yourself and your family through your daily food choices? True health doesn't come from pills or treatments, but from daily choices that respect your body's natural wisdom. Your body isn't trying to sabotage you with high cholesterol. It's trying to communicate and protect itself. Learning to listen to these signals and respond wisely is the path to lasting health and a long life. Prevention will always be superior to treatment, and true knowledge is the first step to effective prevention. The power to transform your health is literally at the end of your fork and the choices you make 3 times a day. Consistent small changes in your diet and lifestyle have profound effects that accumulate over time. Questioning what you've always believed about health can be uncomfortable, but it's often the path to the truth. Your body is incredibly wise and has healing and balancing mechanisms that science is still discovering. Trust this innate wisdom and work with it, not against it, seeking to restore natural balance. If there's one thing you take away from this text, let it be the courage to question, research, and make informed decisions about your health. No one has a more interest in your health than you do, and no one will suffer the consequences of your choices other than you. Starting today, promise yourself that you'll be an active participant in your health journey, not just a bystander. Every meal, every movement, every moment of rest is an opportunity to invest in a healthier and more vibrant future. The true legacy of health does not come from medical services, but from those who know how to take care of themselves and live in harmony with nature. Are you ready to let go of outdated myths and embrace a deeper, more natural understanding of health? Your journey to a longer, healthier, and more vibrant life starts now, with the next choice you make. What will you choose today to honor your body's wisdom and nurture your health for decades to come?